right, 6 minutes after 11 o'clock, Dr. Riadh Fakhoury is in the studio. This is his show. It's called the Head to Toe Care Show, and he will answer your questions about the body that you live in. He takes care of you from the top of your head to the tip of your toe. He's also the owner of Fakhoury Medical and Chiropractic Center and the chiropractic orthopedist himself. The phone number right now to call into the show is the WOCA Climate Control Source Hotline, 352-622-9622. Good morning, Doctor.
Good morning, Larry. How are you?
Good. And when you talk to your listeners, you got the camera a little bit lower. We like that angle. That angle looks nice.
It's a new angle. I like it.
Well, it's a good angle. You look good in the picture.
Okay, good. It's a nice angle.
So how you doing?
I'm doing great. How are you?
I'm doing good. I've been waiting for you to come in today because I read an article the other day I've been dying to tell you about.
I can't wait to hear.
Did you know that NASA would teach its astronauts some basic chiropractic techniques so that when they were up there, I think it's more for the space station than anything else, but just so that they have some techniques handy in case they need to have that kind of care?
Isn't that amazing? It shows you how far chiropractic has gone. You know, we've come a long ways with chiropractic, where back in the earlier years, anywhere from the late 1800s into 1980, let's say even 1990, excuse me, people were skeptical about chiropractic.
I know.
And now things have changed dramatically.
I know there's so much more to this. Let's go to the phone.
Okay.
And then I'll squeeze in some of the information I got off that article because there's one part of it I can't wait to tell you about. Let's go to the phone first. Good morning. You're on there with Dr. Fakhoury.
Hey, Dr. Fakhoury, how are you doing?
Good.
Good. Hey, I was wondering if maybe you could answer a question.
Yes, ma'am.
I suffer from migraines, and I went a whole month thinking, okay, maybe I'm over them. But usually when we had Sandy come through, that was very strong.
Yes.
And Sandy moved up the coast, and then we had that massive snowstorm last month.
Yes.
And I ended up with a horrible 3-day headache, migraine. And, nothing you take cures it. It's just, you just got to live through it. And then sometimes I think they're hormonal, too. Why, if maybe you can enlighten the audience on, why fronts and in certain circumstances will trigger a migraine?
Happy to do that.
Okay, I'm going to hang up and listen, okay?
Oh, very good. Well, a lot of people, thank you very much for that question, because a lot of people do suffer with headaches, and we have a good percentage of patients coming in that are having headaches, and there's different types of headaches. So our caller called in with headaches that are migraine in nature. So a migraine is a vascular type headache, and there's not much that can help that type of headache except taking some type of medications, because you're getting vasodilation, vasoconstriction in the brain, and that affects the blood flow into the brain, and then all of a sudden it opens up and a lot of blood comes into the brain, and then you get that vascular migraine type headache, which is usually on one side of the head, and before it occurs, you'll usually have an aura. Either you'll have a visual aura, or you might have an auditory sense. Wow. So you'll know it's coming. And most people have that warning ahead of time that the migraine headache is coming. The vascular type headache is on its way. So they'll actually take a Furoset or some type of medication to help, hopefully, in reducing the severity or toning down the migraine.
Right.
Because that medication affects the blood vessels in the brain, so that way it doesn't get the constriction, and then the floodgates open up and all the blood just rushes in, triggering the migraine headache. When you have a migraine, it's on one side of the face, in the eye. Usually you want to just not have anybody touch you or bother you. Right. You want to go in a dark room. You want to turn off the lights. You want to just not have any noise, go to sleep, and usually the headache will self-resolve itself. Now, there are other headaches that people suffer with, and those are tension-type headaches, those are neck headaches, those are sinus-type headaches. And I know that there's a call that's here right now. Larry, do you want to handle that call and then come back to headaches? Because there's a little more information on that.
Well, let's do that. And
okay.
We'll line them up. We got a line of topics coming up.
I've got a little note on headaches, so we'll go over that.
All right. Good morning. You're on there with Dr. Fakhoury.
Hey, I had one more question to ask Dr. Fakhoury, and I forgot about this. Somebody had sent me an email the other day that said that they were now using Botox to help with migraines. And I was wondering if you had heard anything about that. I guess when people were using Botox for cosmetic, if they had migraines, all of a sudden they realized that it helped them.
Right. You know, that is an excellent segue to continuing on with the headaches, and I'll talk about that.
Okay, I'm going to
also.
listen. Thanks,
Thank
Dr.
you so
Fakhoury.
much.
Bye.
Thank you very much. Excellent. So we have the migraine headaches, which are vascular. One side of the head, usually aura beforehand. It's a vascular headache that needs some medication. Go to sleep, dark room, usually resolves itself. Might even last to 2 or 3 days. Then you have other type of headaches, and headaches can overlap on each other, so you can have one type of headache triggering another headache. So let's talk about the neck headache. We discussed that before, where the vertebrae, usually the first vertebrae in the neck, which is just under the skull, goes out of alignment, irritates the greater occipital nerve, and that greater occipital nerve starts at the back of the head and goes behind the eye. So what happens is the person will get the pain at the back of the head, behind the eye, usually on one side, get nauseated, again, sensitivity to light, not have any aura, visual or auditory. They won't have the aura. It's not a vascular headache, but it's basically a neck headache. And again, the same thing, dark room, quiet, sleep, gone the next day. So you can see the similarity of those two, where people will think that a neck headache is a migraine or a migraine is a neck headache. So some people will come into the office and say, I've had migraine. Well, it's really not a true typical migraine. It's more of a neck headache that is mimicking a migraine, but it's not vascular. It's basically because the bone is out of position, irritating the nerve. And the difference is that with a migraine, you get the auditory or the visual thing before the headache comes, and the more of the neck headache or vertebrogenic headache starts at the base of the skull and then radiates. People who get that know it because it starts right at the base of the skull,
Right.
and then before you know it, it's behind the eye, and you feel like the eye is going to pop out. You start getting nauseated, and then you just want to, sensitive to light. When you're driving home, you just want to get home and get to bed.
Right.
So, but you don't have the auditory or visual problems with it. And sometimes they work together. So if somebody's under stress, the tension goes from the shoulders up to the base of the skull, pulls that bone out, triggers that neck headache, and then also they can get a vascular component right after that, and then have the two overhanging each other. So, so now this may help the listeners to be able to determine, do I have a true migraine or could it be a neck headache? Neck headaches we could take care of very easily at the Fakhoury Medical and Chiropractic Center, because it's a matter of aligning the atlas or that first vertebrae of the spine back into position and relieving the pressure off of the nerve. And so it's not a vascular type headache. So we have some people coming in saying, I'm getting a migraine, but it's really a neck headache. Adjustment of their neck takes it away. Now the Botox injections may be doing that because they may be putting Botox into the scalp musculatures, because when that neck headache it starts at the base of the skull, and the muscles on the scalp, on the skull, because you have muscles covering your skull, people don't realize that they get tight, they clamp down, and then they can actually cause pain in the scalp, in the head. And so I believe that the Botox injections are relieving those spasms, because the Botox turns the muscles off. The involuntary muscles relax, and that may help reduce the tension headache or the neck headache and give some relief. So let's say that 60% of a headache is migraine or vascular, and 40% is neck headache, and they're overlapped with each other, causing 100% headache. Well, the Botox, the adjustment, the alignment, it might help reduce that 40% neck headache, so the person only has to deal with 60%. Or it might be 100% neck headache. People think it's a migraine, but when they come in and get adjusted, the headache goes away. We know it was 100% neck.
You would know then.
Yeah. And the other type of headache that's very common is a sinus headache. And the way to determine that is that if you're feeling that pressure behind the eye, if you bend forward and look down at the ground, if the pressure builds up behind your eye, that's a simple way, very simple way to determine if it's a sinus type headache. And usually that is a pressure related headache, or an allergen related headache, or a pollen related headache, or a toxin related headache, where the sinuses fill up, put pressure on the walls and can cause a headache because it's a cavity and the pressure is building up there, fluid pressure is building up in there and not being relieved. So that person will have pain usually under the jawbone, around the eye, on top of the eye, in the forehead region. That's where that manifests itself. Can sometimes maybe mimic a migraine headache, but it's more of a sinus headache. You bend forward, the pressure increases. You probably have a sinus type headache, and that's a little bit of difference between those. And that's why the pressure changes from the storms and things will make those sinuses swell more, causing a worsening of that headache.
Okay, and that explains that part. Excuse me. Let's go back to the phone. Good morning. You're on there with Dr. Fakhoury.
Yes, good morning, doctor.
Good morning.
Can you get the Botox treatment at your facility?
We don't actually do Botox at the facility. We have interventional medicine, more of the epidurals, the facet blocks, or radiofrequency trigger points, but not specifically the Botox.
Okay. Can chiropractic application help people with allergy problems, especially this time of the year?
That's a good question, and I'll answer it this way. The answer is yes and no.
Okay.
So, yes, we can help quite often because if the neck is aligned, if there's better circulation of the sinuses, in other words, if the vertebrae, you have, your head is like a sinus system, a drainage system with two pipes that come in front of the atlas and the neck and the top bone, and if that's out of alignment, it could put pressure on that pipe, on that drainage system, causing things to back up, causing ear infections, causing a buildup in the sinus pressure, causing a stagnation. So when we adjust people and we do the manipulation and align the spine, there's better circulation of the sinuses. And when that happens, you're flushing the system. Therefore, the allergens don't stay there causing irritation.
Oh, yeah.
So indirectly, we can help reduce the symptomatology of the allergens and the allergy. However, are we eliminating the inflammatory process or the actual allergic reaction? No, we're not. But we're reducing the symptomatology by making the body work better and the drainage work better so the body can flush the system better and not be restricted at all.
Okay. Well, thank you very much.
Thank you. That's an excellent question. Thank you.
And if you'd like to ask Dr. Fakhoury a question, you may call right now. The phone line is open, and the number is the WOCA Climate Control Source Hotline, 352. Is the area code, and the rest of the number is 622-9622-622-WOCA.
Hey, I've just got handed 2 tickets to take a shuttle up to the International Space Station, Larry. You and I are going to go up there, and we're gonna see the adjustments
Wouldn't that be awesome?
And help them out over there. Tell me a little bit about this article. I missed it.
This is what I wanted to tell you. I thought this was pretty interesting and applicable to us. We're not astronauts. Okay. So NASA used, I don't know if they've ever sent a chiropractor, a fully trained chiropractor like yourself, but apparently they give them chiropractic techniques so they understand how to perform certain things on each other when they need it. Okay.
Yes.
This is what they discovered, that their sleep is more restful when they've used these procedures.
Oh, I love this.
Okay. They've discovered that their resistance to common ailments like the cold and the flu are increased. Their resistance is increased. And I can't remember the rest. But it was like common things that we all go through, and the fact that they use these, I don't know how many diseases they would be exposed to in that isolated environment, but clearly they're. This was my thinking on this one. If you're sleeping in a place where there's no gravity, it's got to be different, if nothing else.
That's right.
And your ability to rest in that environment must be a challenge, I'm guessing.
Well, I'm not an astronaut, and I'm not in that environment, but imagine being in a weightless environment. First, that would be very cool, wouldn't it?
It would be.
Just floating around. I think you and I would enjoy that about 2 hours, and then we'd be finished with it.
Right.
We're done with this ride. Let's go back.
Exactly, yes.
So, but the weightlessness, now they're probably tugging and pulling on different items to bring them to them. They're probably reaching, because if your clipboard is floating away from you, if it's not tethered, you're reaching for the tether, or you're reaching for the clipboard to bring it to you. You may have to sit down in a chair to be able to do some type of work, whatever it may be. So you might be reaching and pulling yourself to the chair. So I can see where they're using their body to pull things to them, or they're pulling themselves to a chair possibly, or to a table to sit down, or a computer. So in a scenario like that, I can see where the tugging and the pulling might cause misalignments or things to go out of position, causing discomfort.
Yeah, yeah.
And they may just be floating around and bang into things also, push into a wall or something. So that might irritate it also. So I could see where the need is that when you're up in a capsule and you're contained and you can't call somebody to come help you, you need to be able to have self-sustaining ability to take care of yourself.
Right.
So they probably train themselves not only chiropractic but medical emergency procedures to be able to help each other if there's an emergency. So in a weightless environment, you're not putting pressure and you're not doing much exercise. Therefore, your muscles get weaker, your bones get more osteoporotic. Hence, you're probably more susceptible to things slipping out of alignment, because if your posture is weak, if your muscular balance is weak, if your muscular tone is weak, then the vertebrae could be shifting in and out of position, where an adjustment could be very helpful for them.
Yeah, and the application here, I mean, we've never talked about being insomniac or something and understanding that somehow maybe I have no pain, but I'm just not sleeping well. Going to see a chiropractor might help that.
Excellent. We'll talk about that. I know there's a call here, and we'll talk right afterwards.
Good morning. You're on the air with Dr. Fakhoury.
Hi, Larry.
Hi.
Hi, Dr. Fakhoury. This is June. How are you,
Hi,
Dr.
June.
Fakhoury?
Very well, dear. How are you?
I am telling you that procedure that I had done there, was it called electrical stimulation on my shoulder?
The neurostimulator?
Yes, it really gave me some relief.
Fantastic.
So I'm coming in tomorrow. I had rescheduled another appointment, and you said by 2 or 3 times I would know if that was going to help me, and I really do feel a relief from that. So I just want to tell you that was a success.
Well, congratulations, June. That just really lightens my heart, and I feel wonderful with that. And should I give a little history to the callers of your call from last week or not?
You can. It's up to you. And I just want to say this is, if anyone's having any pain or anything like that, please go to Dr. Fakhoury. They're just wonderful there. They will do anything they can to help you. And I mean that sincerely.
Are you sleeping better?
You know, I don't really have a trouble sleeping. I'm one of those luckier ones, I think you could say.
Okay, all right.
But other than that, no, I've never been into space. Maybe in my mind, but that's about it.
Well, we'll get another ticket, June. The shuttle can hold 6 people.
Oh, no. Okay, I'll listen to it, and thank you, Doctor, so much. I'll see you tomorrow.
Thank you, June. So June last week was mentioning the shoulder the pain was getting quite uncomfortable, arthritic. A shoulder replacement was suggested. When do you do a shoulder replacement is the question. And the 2 points we said is when the pain gets so severe that it's affecting quality of life, or when it may be restricting your activity level in a way that you're not comfortable with. For example, if you like to golf 3 times a week and you can't, and that's building up a tension in you and a stress in you that you are very unhappy with that, then at that point the surgical procedure is required. So pain and restriction of your daily activities. So June visited, and we looked at different options, and things were eliminated. But there was one machine we talked about called the neurostimulator, which is a German-made machine, probably the only one in the Tri-County area, specifically made for pain. It puts a special electrical current into the joint or into the body to be able to turn off the nerve endings and stop the pain message from going to the head. So it's an excellent modality that we have. And the full treatment takes maybe about 20 to 30 minutes, and it's not painful at all, but it does it deactivates the nerves that could cause headaches, shoulder pain, hip pain, knee pain, back pain, and peripheral neuropathy. So when we've tried everything else and there really isn't anything, and we're considering surgery, then that machine has helped many people avoid surgery. For example, we have a lovely young lady, maybe about 20, 21 years old, now maybe let's say about 24 years old. I've known her since she was 9 years old. She has severe scoliosis, had the surgery with the rods, doesn't want another surgery.
Oh, wow. Yeah.
So we're doing the neurostimulator, the electrical analgesia neurostimulator treatment, that's German-made machine, which has been tremendous at helping the pain in her legs and her back and giving her a tremendous amount of relief to a point where she's not needing the surgery. And, surgeons are very happy with that, because if they can avoid a surgical procedure, they want to do that. In fact, one we refer a patient to the surgeon. Sometimes they'll refer them back and say, try this or try that, to try to find another conservative medical or chiropractic treatment at the Fakhoury Medical and Chiropractic Center to help control that patient's pain to a point where it's tolerable, so that way we can try to keep the care more conservative.
So she literally did not have to get the surgery in just 1 week's time.
Well, we did one visit. We said let's give it give it a fair chance. Let's do 2 or 3 visits, and you'll know. I'll know, and you'll know if it's helping. If it is, that's wonderful. If it isn't, then at least we tried the final thing to try to avoid the surgical procedure.
And in her case, just help me understand the science behind the machine that you're talking about. Does it do pulsing, or what does it do actually?
Well, it takes electricity and it converts it, and there's 10 phases to the machine, so we can do different types of treatments. Each phase will treat a different type of problem. It might be a circulatory problem, might be a pain problem, might be a muscular problem, might be a joint problem. So there's different categories that this machine has for different ailments. So what we did is we used a phase 10 and a phase 10 and a phase 1, and the phase 10 is electrical stimulation, maybe 10, 12, 14 different types of electrical current to affect the muscles from different angles to try to turn the muscles and the pain off. And then phase 1 is where a surge of it's not painful, but a surge of electrical current will go into the nerve and deactivate the nerve, basically turn the nerve off.
Oh, wow. So the physical thing that's causing the pain is still there, but she just doesn't feel it? Is that?
That's correct. In that case, with the electrical analgesia, it's turning off the pain, and so that will allow the patient to move and be because the shoulder joint is arthritic, it's not life-threatening, and it's already a damaged joint.
Gotcha.
So if you can maintain motion, so you're not causing more damage. You're actually, if you can move it with less pain and bring mobility back into it, you keep the joint moving. You would reduce adhesions and scar tissue and the drying out of the joint and accelerated arthritis. So you actually slow that process down. As you know, motion keeps things alive and keeps things working. So it's the lack of motion that causes the arthritis. So when we're in pain, we don't move it, the arthritis gets worse. So in this case, the joint is damaged, so it's not, we're not correcting that, but we're blocking the pain, allowing that motion in there without the pain, so that way it either reduces the chances or eliminates the chances for surgery is what our goal is.
Do our bodies lubricate the joints automatically? And they do?
They do. There's not all the joints, but certain joints have a lining called a synovial membrane, and that lining covers the bone, and it produces fluid called synovial fluid. And that fluid, and the joint is in a capsule, so the fluid fills that joint up and that capsule up, so it allows us to be lubricated in motion. And it allows the bones, and the synovial membrane is like a Teflon coating, so they slide on each other. They don't rub on each other. So hence, back to question number 1, why does pressure changes? Why do we get pain in certain joints? Well, if the joint is weak, there's fluid in the joint, and the pressure changes can cause that joint to swell and cause pain in that joint. And so, but there is fluid in the joint, and when the joint stops moving, the fluid slows down in production.
That's what I was wondering. Yeah. So,
or if the vertebrae is out of position, then the joint is not working properly, because you have to have a motion on that lining to produce that fluid. So if the joint's not moving because the vertebrae is out of alignment, or you're not moving the shoulder because of pain, then the membrane doesn't make the fluid, so the joint dries out. And that's where chiropractic helps tremendously also, because when we manipulate the joint, people say, could that hurt me? No, it's the opposite, because when we bring the joint into alignment, those ends are now connected instead of being offset, and then the motion starts, and when the motion starts, it lavages the membrane, and then the membrane starts to produce fluid. Hence, people feel better, more fluid, more flexible, with the adjustment, with the manipulation, with chiropractic care. And then when you have less pain, you get a better night's rest. You can go into a deeper sleep, so that way you can be more rested. And when you're more rested, you're more rejuvenated, so your energy is higher. So in that article with the astronauts, They probably rest better because there's less irritation on the body, and the body's functioning better, so they can go in a deeper sleep. They're probably more energetic and rejuvenated because of the fact that their body is less stressed. Less stress on the body means better function of the body. It's more efficient, and the energy level will go up from there. Resistance is better because if your body's not busy fighting off this pain and that spasm and this problem here, now it has extra energy to focus on resisting things and fighting things, so the resistance goes up. So when we see people coming in and getting regular adjustments, we see the tendency of their colds and flus to be reduced. Hence, that's why a lot of times parents will bring their children and say, I go to the chiropractor and my kid doesn't get sick. You've heard that before.
That makes sense, yeah.
Because the body's working better, there's less stress, there's better function of the body. Hence, there's less, susceptibility to these problems.
Now, if we could just get our elected officials to realize that NASA is using chiropractic techniques. Whatever they did to this new law that we can't go see a chiropractor after an accident, that's crazy.
Well, you can, but you have to do it within 14 days. If you don't do that, you lose your benefits.
Oh, okay.
So it's critical.
Oh, okay. Well, I misunderstood that.
Those folks that say, I'm going to wait it out, you can't do that anymore. Come in, at least get evaluated, the file is open, because it might be a month or two before you turn and then it just severe pain and then you come in at that point. But at least there's been some documentation as to what's happened.
Yeah, June's story, the story from NASA, all these things point to the same message you've been saying over and over again. You don't have to live with pain. You don't have to be insomniac. You don't have to have headaches, right, from the first caller.
That's right. That's right.
Where are you? How do we get a hold of you?
You can find us on 17th Street, Larry. If you cross over 441 on 17th Street heading towards 200, go over the Governor's Bridge, the new bridge. At the bottom of the bridge, look to the right. There's a tan building. That's a Fakhoury Medical and Chiropractic Center. There's a light there. You can make a right, come right into it. If you're coming from 200, same story. Before you climb the bridge, we're on the left-hand side, and we're open 6 days a week. The number, if you have any questions or want to come in for an evaluation, is 351-3413. That's 351-3413. Extension 4 will take you to our patient care coordinator or front desk. Any questions on insurance or treatment time, you're more than welcome to speak with them. They'll be happy to help.
All right, good show. Good show as always. Sometimes you outdo them, and I don't know, you just keep...
You came with a great question.
Upping the
great
limit.
Comment.
I read that article. It's amazing.
Good for you.
I'm going to forward it to you if I can find it again. I was talking to Robin about it. She said I should forward it to you.
We'll study it together and get some more information from it.
Thank you. Thank you for all you do for all of us.
Thank you, Larry.
We'll take a little break, and we'll be right back.
Accident, injured, hurting, pain affects so many of us and keeps us from enjoying our daily routine. This is Dr. Riadh Fakhoury, board-certified chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center. Let me visit with you to answer your questions. Let us help you help yourself on the Head to Toe Care Show every Wednesday, 11 a.m. on WOCA. Again, that's Dr. Riadh.